Good afternoon. My name is Nick Hobson. I'm the FSS Family Support Services statewide coordinator. I just want to welcome everyone to um, the following training slash informational session regarding the FSS family reimbursement ADM and the program in general. So before we get started, I just wanted to go over the purpose of today's training. Um, so the little bit of the background in the last, we'll say, year or so regarding the FSS Family Reimbursement Program and the subsequent ADM. Our goal was really to get the program to be more consistent across the state. We had learned as we went through this process that different different goods and services were being reviewed and reimbursed differently in different parts of the state. So it was really important to us to get the program more aligned so that we weren't seeing those differences in depending on where you live in New York State. And going along with that, it's crucial that we ensure consistent messaging and clarify practices regarding the goods and services that are available through the FSS reimbursement program. And we've done that largely through updates that we've made through an FAQ document that's now available on the OPWDD website, where you find all of the other family reimbursement ADM documents. Um, and as I mentioned, there are several updated documents. It's not just the FAQs, but we've also made some changes to the application itself. We've also updated the tracking spreadsheet, and we've included directions that go along with that tracking spreadsheet. Um, and just again, to reiterate, as we've worked through the process of making these updates to the program, OPWDD worked with families, care managers, providers, and regional office staff to provide guidance and additional clarification. So it's really been a collaborative effort between all of those groups to get to where we are today. And once again, just to reiterate this, you can find all of those available resources, including the ADM, things that we've updated, and the FAQs, as well as the updated allowable and non-allowable list, all on the OPWDD website. So real quickly, I'll provide an overview to everyone before we get into some of the more pertinent parts of today's training. The Family Reimbursement Program is meant to provide assistance to families by easing the expenses of providing care to their family members with either intellectual or developmental disabilities. The standard remains that reimbursable goods and services must be first related to the person's intellectual or developmental disability and also deemed appropriate and necessary to meet the needs of the person by the FSS provider. Um, and those standards have not changed. Those still remain and are critical pieces when the provider or anyone at OPWDD is reviewing any of these um, reimbursement requests. Effective July 1st of 2022, the FSS reimbursement practices were revised and clarified with an ADM. And like I said, now it's been just about a year that ADM has been in effect. Um, but I think the crucial thing to realize about the ADM is that it's continually evolving, and that's why we're taking the time today to provide this additional training. Um, under the idea and the goal of getting everybody on the same page. And as I mentioned in my previous slide, the ADM and FAQ documents specific to reimbursement were updated, and there are several clarifications that we made in those documents that we will get to later in the training. In terms of eligibility, this is also not anything that has changed, but I think it's important to reiterate today. To be eligible to receive or be enrolled in FSS, a person must have established eligibility for OPWDD services. They must also reside with one or more non-paid family members. Like I said, these are nothing new. These continue to be the expectations and the requirements of the program. So people who reside independently, meaning outside of the home of a natural unpaid caregiver within OPWDD certified residential programs, or who reside in certified foster care settings, remain ineligible to receive FSS services. And that's just the other side of this point, that the FSS program is meant to maintain individuals at home with their family or caregiver. So if an individual is in one of our certified residential programs or they're in a foster care home, then that's would make them ineligible to receive FSS services. And then another clarification, which has been mentioned several times, but is important to point out again, is that care management is not a requirement to receive FSS. The caregiver of an eligible person may apply to receive FSS, meaning that they can submit the application on behalf of the individual, but they still must follow the established application process and program parameters when submitting those applications. Like I said, I feel like we still are receiving some questions about, if care management is required, and it is not. One final point about the housing before I move on. The included in OPWD certified residential programs is the OPWD housing subsidy program. And as mentioned with the other residential programs, if an individual is receiving a housing subsidy, they would also be ineligible for family reimbursement. And once again, it's under this same idea of, if an individual is not living at home with a unpaid family member or caregiver, then they're not meeting the requirements of FSS.
Just something that we have been asked to clarify over time is included with OPWDD certified residential programs is the OPWD housing subsidy program. So if an individual is receiving a housing subsidy, they would be ineligible for family reimbursement. Obviously, if they're receiving a housing subsidy, then they're living independently. So that's why that's in place and the clarification was made. Next slide. So this next slide is going into a little bit of the learning curve for all of us as we've implemented this. OPW staff have streamlined the decision-making and reconsideration process for reimbursement requests in order to ensure consistency and standardization statewide. In other words, all of this work has gone to making this program more standard across the state. Sure, many of us are aware, different parts of the state, different regions, things were done different. Different items were reimbursed for in one place and maybe not another. So the ADM and all of the additional documentation that goes along with it are really meant to make it so that no matter where you are in the state, you're receiving the service, you're receiving the reimbursement the same way. Providers are encouraged to use the ADM and the FAQ guidance to respond to the needs of those who are enrolled in the program. Regional office, their role in this is they should be utilized for technical support and guidance as needed. And the provider remains responsible for communicating reimbursement decisions based on the ADM requirements. So in addition, following the effective date of the ADM implementation, providers and caregivers expressed some concerns about the timeliness of this new process and some of the delays. And as mentioned, we've had this ADM out there for about a year now. And so we noted that obviously it's a different process. We have, specifically, which I'll discuss a little bit more, we have the tracker that's involved along with a different application, a standardized application across the state, and that does add some of the time around these reimbursement requests, but once again, it's also important, and we felt it's important, and it's in place in order to help with that standardization across the state. So as with any new program or significant changes around service delivery, there has been a learning curve throughout these, like I said, close to the last year. But we are continuing to work through it, and that's why we treat the ADM and the FAQs as a living document, because we know there's going to continue to be questions and clarifications that need to be made. Next slide. And you're going to hear the word clarification a lot this afternoon. Some of the clarifications we made, some of those new attachments you're going to see are revisions to the application, revisions to the tracker, and instructions that go along with the tracker, updates, clarifications on the FAQ document, considerations for the allowables and non-allowables list, and updates and clarifications on the items on that list. Okay, next slide. So specifically, we made really a few minor tweaks to the application. Specifically, question 7A is a new question and asks, is the individual enrolled in Medicaid? We've realized that that's a pretty important question, since the tracker now also reflects that question and is needed information in order to make a determination on these requests. We also reworded question 7C a little bit. We broadened it so it wasn't just specific to the CDPAP program. It now says, is anyone residing in your home receiving payments to provide care to the individual receiving services? And then question 9, we removed the requirement around the notice of decision or other OPWDD eligibility documentation. So the reasoning there is, a lot of times we realize families may have gotten some of those documents so long ago that they may not have them or know where they are, and the DDRO staff are able to check those things, and that's part of why we have this tracker process going. So we realized it wasn't really necessary to have that in that list of required documents. Next slide. So some of the revisions to the FSS reimbursements tracker and the instructions. Previously on the website, obviously, we had a tracker attachment C. It was a spreadsheet with several different columns. And then we had a revised tracker that was in use but wasn't officially on the website. So we have taken those two, made one wonderful tracker, and we have all of the columns that we need in order to, like I said, make a strong decision and a recommendation on the requests as they come in, and to be able to provide better oversight. So the columns now that you'll see include, is the individual enrolled in Medicaid, the waiver, has it been reviewed by the FSS committee, the date of the request, the item specifically, if this is a one-time or ongoing request, and if it is ongoing, the frequency of that. Does the individual live with a family and or caregiver? Clinical justification. Next slide, please. The preservation of the family unit, the cost-effective options were explored, providing a web link to the item if it's applicable, alternative funding sources explored, if the individual is connected to a CCO, if the item's listed in the life plan, and how it shows the connection to the individual's disability and why it's needed. And then there's also a notes column. I'm just going to highlight a couple of those columns since they are new from what was previously there. The preservation of family unity is intended to support keeping, FSS is intended to support keeping individuals living at home with their families. So it's imperative that the item requested shows how it supports the individual remaining at home. So I think that's really key when we're seeing these requests or they're being submitted, that it does tie back to how it keeps the individual able to live at home. The cost-effective options column, there are cases when a more cost-effective option could be utilized. One example that I think we've seen several times is gym memberships over paying for a personal trainer. So, an individual enrolling in a gym membership, is definitely a more cost-effective option than a personal trainer and gets the individual to the same kind of health-related goals. So, that's just one example, but once again, looking into cost-effective options is critical and an expectation of the program. And the last one I wanted to highlight real quickly is the connection, the life plan connection to the disability. The requested item needs to tie back to the goals of the individual and their life plans and clearly show how it's needed. I'm going to get more into the life plan pieces in a few more slides, but just wanted to highlight that at this point. And next slide. The FAQ document, once again, just real quick, it was in response to stakeholder feedback, and we got many requests for additional clarification. And like I said, that is on the OPWD webpage for everyone now. Next slide. Some of the highlights of the FAQ, several of the areas we clarified include life plan documentation, clinical justifications, what's needed, and for which items specifically. We clarified more around FSS respite reimbursement and an individual's waiver status. More information around different funding flexibilities, whether that's a partial reimbursement, direct purchase, or prorating of shared items. More clarification around emergency reimbursement criteria, and also more on FSS criteria for those enrolled in self-direction. Next slide. The life plan documentation and the care manager responsibilities. So for those who are enrolled in care management, the FSS provider identified by name and type of service should be listed in Section 5 of the life plan. That's straight from the ADM. That's not anything new. But once again, we really want to stress the importance that FSS, where it needs to be listed in individuals' life plans, and I'm going to say this now and repeat myself, that it also is, the life plan is part of the application package. So when that's reviewed by the provider, they need to see that, that the individual's enrolled in the program and what one it is, and that it's in the proper section. A brief justification or overview of the service or item should also be listed in section 1 of the life plan. So that's going back to what I was saying earlier about this connection between the requested item and the goals of the individual in their life plan. So all of this, where it's listed and how it's documented is key, because the life plan really, provides this roadmap for the individual and the services that they're enrolled in and their goals. So having all of this listed in the life plan is critical for those reasons, and why we're stressing this afternoon. Services and items that are listed and their accompanying statement should provide underlying support for the need and correspond to each enrolled FSS service. So this is a little bit broader than just family reimbursement. Obviously, someone can be enrolled in several FSS programs. Could be family reimbursement, could be behavioral support program, could be, any number of things, an after-school program, and all of those services also need to be included. So once again, it's really important to be clear about, what services the individual is receiving and how it all connects to their disability and to their goals. Next slide. So just a little bit more around life plan documentation. Care managers should ensure that all waiver and non-waiver services are both current and accurately listed in the life plan. And that obviously includes things like CDPAP and self-direction. Care managers are also responsible for alerting providers in a timely manner of any status changes to services listed in the life plan. So that could be things like a launch of initial self-direction budget, those aging out of school, those withdrawing from site-based programs. So those are just a few of the examples, but certainly not all of them. And required information in both sections 1 and 5 should be included in the life plan no later than the time of the next scheduled life plan review, or when requesting a new service, whichever one may come first. So that essentially means, if there's new FSS services being requested, and it's, in between when the review, or before the next review meeting for the individual, then they need to be added to the life plan and submitted as part of the application process. Next slide. A little bit more around life plan documentation. A common question we've received is, does the provider receive copies of the life plan? And once again, yes, they need to be submitted along with the other required documents as part of a completed application. And on an ongoing basis, but no less than with each application submitted, a copy of the most current approved life plan addendum should be forwarded to the FSS providers. Next slide. So another question we've received is, I was informed that the person can only have one agency listed in their life plan. If this is so, how should the information be listed for people who access different services through multiple providers? Which is a very good question. So in both sections 1 and 5 of the life plan, as well as in the self-direction budget, if an individual is enrolled in self-direction, there's a possibility that multiple agencies would be listed for separate non-duplicated types of goods and services. So in those cases, there can be multiple listings documented in the life plan, distinguishing all their identified programs. This is hitting on a point I made earlier. An individual could be enrolled in family reimbursement and then also a behavior support grant or a behavior support program or an after-school program, et cetera. And it's critical that all of that's lined out properly in the life plan. Next slide. So this is next couple of slides are about clinical justification. We definitely received several questions about that, so we realized that needed to be expanded upon a little bit. The family or the caregiver must provide the FSS provider with a clinical justification that indicates a significant, definable positive impact on the individual directly relating to health, safety, emotional well-being, normalization of life, accessibility, needed services, personal growth, and or development of the person. So that's all language that's currently in the ADM. We just wanted to highlight it again. The clinical justification must also be clinically indicated and substantiate the need for the item or service that's being requested. And in addition, it must be supported by a clinician, demonstrate a clear connection to the person's disability. Also of note in terms of clarifying all of this, clinical justifications are required for all goods or services that are clinical in nature. For example, things like sensory items or clothing items, it would certainly need a clinical justification. It all ties back to if the item is being requested based on individuals' behaviors or things that are related to their disability driving the need for that item, then there needs to be a clinical justification. Now, there's obviously other items, things like camp or respite, that aren't going to require a clinical justification. But that being said, those items still require a justification. We still need to know, the provider and the regional office still need to know why, what's the reason behind this request. So there may be other items that don't necessarily require this level of clinical justification, but that doesn't mean that they don't require any justification. Next slide. Clinical justifications from clinicians are needed and can include several different practices, but not limited to things like physical therapists, occupational therapists, speech therapists, physicians, registered nurses. That's certainly not the exhaustive list. And the clinician must provide a signed letter that's dated within a year of the request that demonstrates the need based on the criteria listed in the above section. So once again, that's just putting better parameters around what's needed with the clinical justification. Next slide, please. Next slide is around impacts of waiver status on FSS reimbursement. So individuals who are enrolled in the HCBS waiver must access waiver respite prior to applying for FSS family reimbursed respite. Oh, the critical point here is that if an individual is enrolled in the waiver, it doesn't matter if they're enrolled in waiver respite or a different service, but if they're enrolled in the waiver at all, then the waiver should be explored prior to looking into or trying to access FSS family reimbursed respite. The person or the family, along with the care manager, if they have one, must explore if waiver respite opportunities are available. And if staffing is not available from any waiver respite providers, individuals' families can then apply for FSS family reimbursed respite. Next slide. This is additional clarification around self-direction and CDPAP program. The FSS family reimbursement ADM was intended to avoid duplication in service provision and to allow for more equitable access to this limited resource. Once again, many of you have heard me say that FSS is a 100% state-funded, completely state-funded resource. This ties back to what's in the ADM on page 7. Guidance has evolved for applicants of FSS reimbursement who are enrolled in self-direction or the CDPAP based on gaps and allowances within those programs. Next slide. So FSS reimbursement is allowable only prior to the approval of a person's initial self-direction budget. or under the special circumstance or specifics, to self-direction as described in section P of the ADM. And then you can also see more about that in question 8 in the FAQs. The self-direction budget's responsible to cover item services once the budget's approved. So this is simply stating that if someone's enrolled in self-direction and their budgets become officially approved, once we reach that point, then if they were receiving any reimbursement through FSS, then their self-direction budget needs to start covering those things. And the budget must include FSS prior to reimbursement application submission. That's not a new requirement, but again, we're going to stress that everywhere that FSS needs to be documented. Next slide. So this is more about the CDPAP enrolled individuals. Once again, paid caregivers are not eligible for family reimbursement. Family caregivers, though, who themselves provide paid services to a person they live with through the CDPAP program, are not eligible for family reimbursement. When a person receives CDPAP only from one or more staff who live outside of their home, their family is eligible to apply for family reimbursement. Once again, if the caregiver lives in the home with the individual they're providing care to, they are not eligible for FSS family reimbursement. If the family is paying someone who lives outside the home to come in and provide that care, then the family would be eligible to apply for family reimbursement. Next slide. So considerations for the allowables and non-allowables. So FSS is meant to be utilized as a short-term, time-limited resource when alternate funding sources have been exhausted. It's also a complement and not a supplement to other available program services and other funding streams. Items, services requested must be directly related to the person's disability. Routine expenses one would occur in caring for a loved one without a disability or raising a child remains the responsibility of the caregiver. And just also important to note before we get into the allowables and non-allowables is that an application submission does not guarantee that funds will be awarded. Just a couple other things I want to point out before we move on to the next slide here. So in an earlier slide, we discussed a little bit about this waiver status for individuals. And I think it's, again, important to note that, as we've said, individuals enrolled in the waiver need to explore the waiver, for respite or for whatever service that they're looking for before coming to FSS. But there's also the other side of it where you may have, someone new to the OPWD system coming in through the front door, and they may only need family reimbursement, or they may need some other FSS service in order to keep their family member at home. And so that's where I know there's some confusion around this payer of last resort idea, but really it's all depending on where the individual is coming in and, once again, what they actually need, from OPWDD or from FSS specifically. So I just want everyone to try to keep that in mind, that that can be a confusing concept. We're trying to be more clear about that, but accessing the waiver, if individuals and families can, is most ideal if they're enrolled in the waiver. But obviously they can be new to the system, and it can make more sense for them to look into or to be guided toward FSS as opposed to being enrolled in the waiver. The next few slides are the updated allowable, non-allowable. Can you go to the next slide? I'm not going to go through the entire list. This is now available on the website. This is what we have done over the last few months with this list, which I'm happy about, is we've done some categorization to it. So you can see a whole host of items that are allowable, but we put some headers around those. On this slide, you can see this is specifically recreation activities, programs, equipment, and this gives you several different things that fall under that category. Next slide, please. And this is a continuation of that list. Some of the other major categories being sensory items, and then some of these also include what was currently in the original ADM list, things like respite, camp, electronic devices, supplements, legal fees. Those are all continuation, or all have been added to this list. So we're pointing everybody to look at that list that's on the website, as opposed to going off of what's on the ADM. And that's really also goes along with the FAQs. Both of these documents are really extensions of the ADM. So when you're looking for the latest and greatest, you really should look to those documents, because they're going to give you that additional information and the most updated information. Next slide. And then the other couple of carryovers from that original list, clothing, and also other items as deemed by the regional office. Next slide. And then we have updated the non-allowable list too, and we have several categories that go along with that. Things like healthcare or personal care items, household expenses, travel and transportation. Next slide. Fiscal expenses, and then duplicative expenses, things that may be otherwise covered through some other funding sources, including the HCBS waiver. Next slide. And then we've also added educational-based services and goods, and some things that miscellaneous that were difficult to capture any other way but miscellaneous. Like I said, I'm going to encourage people to look at this on their own time, but we will be continuing to update this list. So as we do that, we will be putting more updated lists on the website. Next slide. The next slide is regarding partial reimbursements. Once again, these are a lot of things that are currently in the ADM, but we're taking the time today to highlight them so that people are aware of them and do realize that this may be the way to guide a family or individual when they're seeking family reimbursement. As a 100% state paid service, any goods or services, once again, must be cost effective. So when there's a comparable item that's available at a lesser cost item must be purchased or utilized. But partial reimbursements for goods and services are really at the discretion of the provider. The easiest example that I've heard is regarding camp. We know sometimes individuals or families put in for camp reimbursement for more than $3,000, and if a provider is seeing that, it's their discretion if they're going to partially fund that request. And if they choose to do that, the family would obviously need to be made aware that they've exhausted their $3,000 for the year, and they're still going to be responsible for whatever the remaining cost is of the camp. Next slide. Direct purchase, like I said, this is also currently in the ADM. This is an option for expenses which are needed immediately or without delay. Providers must provide this option to families, and the caregiver must submit must submit an explanation of the hardship describing why the family can't pay for the item up front. Next slide, please. A little bit more about direct purchase, and attestation of household income, demographics, or financial obligations may be required. I just want to stress that may be required. That is not definitely required. Funding is not guaranteed and would need to adhere to the same guidelines and standards as reimbursements. So once again, it's the ADM lays out the process, and it still needs to be followed even if the direct purchase route was where you were headed. And then lastly, if the item was sold or returned or the service isn't received, the caregiver must notify and reimburse costs to the FSS provider. Next slide. And then this is about shared items. Once again, from the ADM, items to be shared by others in the household must directly relate to the needs of the person with the disability and will be prorated based on the number of residents in the home. So once again, that's from the ADM, and we just wanted to take this afternoon to highlight that so people are aware of those things as potential options. Next slide. And the next few slides are some of the emergency reimbursement language and also clarifications in this. So there's the emergency reimbursements may be allowed on a short-term basis as a result of a crisis or because the person or the family is in great need of specialized assistance with appropriate supporting justification. The family reimbursement for these emergencies, though, is not intended to cover chronic, ongoing crisis situations. And emergency reimbursements may only be awarded once per lifetime per family for each type of emergency. The ADM outlines several different emergency reimbursement types, and a family or individual is only entitled to, or only may be awarded each of those once per lifetime. So once again, this is still the same language that's been in the ADM from July 1st. So one of the second point I made in there about it not being intended to cover chronic, ongoing crisis situations is why the need for additional justification and a plan on how this is going to help move the family out of that situation is part of the emergency reimbursement request. Next slide. So emergency reimbursement request must include all the information as a general reimbursement request. And like I mentioned in the last slide, some of the additional information that's needed is documentation substantiating the need, description of how the request addresses an immediate short-term crisis that impacts the health and safety of the individual. And then I think this is the most important piece, is a plan to prevent the reoccurrence of the crisis. Once again, emergency reimbursement requests are meant to help the individual or the family move out of that crisis situation. So it's pertinent that a plan accompanies those requests. So, it's clear that, the reimbursement, if it's approved, is really helping the family get out of that situation. The application must also reflect the emergency reimbursement need by checking yes on the application in section 5. And also of note that the emergency request funding is separate from the $3,000 statewide cap for family reimbursement. So just so everyone is aware, it's not counted. Emergency reimbursement requests are not counted against that $3,000 cap for general reimbursement requests. Next slide. So When an FSS provider receives an emergency request, they must contact the regional office immediately. The provider must submit the reimbursements tracker and designate it's an emergency expenditure on the tracker. And the completed application must also accompany that. Next slide. The reconsideration process. So this is, once again, how the ADM currently states it. On page 6, providers must develop a reconsideration process for individuals, families who would like their application to be reconsidered if it is denied. So this is all the current ADM language. Next slide. The reconsideration process must include notification that the family or the individual has 15 days from the receipt of the provider's written denial to request reconsideration, the opportunity for the family to present additional documentation to the provider, and the opportunity for the family or the individual to engage in informal dispute resolution with the provider to discuss the concerns about the denial. The FSS provider must give written notice to the individual and family and care manager about the results of the care of the reconsideration process. So that's just saying that everybody needs to be notified of what's going on to be able to facilitate the reconsideration process. Next slide. The reconsideration process also, if the provider upholds that denial after the process is complete, then the notice that the family receives must state that the individual or family can appeal the decision to the RO no later than 7 days from the receipt of that, and contact information for the RO must be included in that notice. If the requested item or service is denied by the provider, reconsideration occurs at the provider level. Well, it's at the regional office level at that point. And then the individual or family will have 15 days from the date of notice to appeal that. And then if the, lastly, and I know that there has been some confusion about this piece, if the good or the service is denied by OPWDD through our review process, then the reconsideration is going to be done at the OPWDD central office level. So I'm just going to take a second to explain that a little bit better. So the provider, as I stated earlier, it's their responsibility to issue the denial letters to the families. If that denial was, if it was only reviewed at the regional office level, then the final reconsideration is going to be done at the regional office level. If that request reached the central office reimbursement review level, then the final determination is going to be made by central office review. So and we're trying to make that as clear as possible because we definitely understand some of the frustrations around that. Slide. A couple more slides on the reconsideration process. In addition to the denial letter being issued by the provider, if they uphold the denial after informal dispute resolution, the regional office must also be included on that, and the notification must be sent to the respective regional field offices. The next slide has all of those email addresses for the FSS regional office staff, and what we can do is these will be shared out following this, so everyone has these emails in order to be able to include the appropriate regional office staff. Sorry, did I skip ahead without saying next slide?
Oh, sorry.
And then can you go to the next slide that says oversight? Thank you. And then the last couple of slides, the oversight piece once again from the ADM, the providers must establish a system for monitoring and verifying goods and services are used for their intended purposes. Providers must investigate any suspected fraud or misuse of FSS reimbursement. Through the time that the investigation is completed, payments should be suspended, and if fraud is suspected, the provider must contact the regional field office and follow the process as outlined in the ADM. Next slide. And this is, as promised, the link to the FSS ADM and all of those various attachments and FAQs. And next slide. And then this is how you reach us at the FSS team here. That's the shared email address. I'm going to turn it over to the chat box QA in a second, but if we don't get to anything today, like I said, we're going to take all your questions from the chat and respond, and you can also reach us through that Family Support Services shared email. Thank you. So two things that I was noticed people were asking about. We're going to post the slides as well as the recorded training to that same, the same place on the website that you just saw on the last slide. So that will be available there. And then in addition, if there are requests for translations of this, please send them to that Family Support Services shared email, and we will work through those as we get them. Thank you. Oh, one question or several questions were regarding if there is a new ADM. The ADM is not been updated anyway. It's still the same as it has been since it was issued in July. The application, the tracker, and the FAQs are all of the updated documents, and as I said earlier, are an extension of the ADM. I do also want to clarify, because I mentioned about translations. Currently, we have only the application's only in English in the updated version, so that should be used at this point. We are working to get all of the other translated versions of that created and on the website. So in the meantime, though, everyone can use those translated versions still, even though it's the old application, because like I mentioned, there was only minor changes made to the application. And once we have all of that created and on the website, we'll certainly let everyone know. One other question we received a little bit more, asking for a little more clarity on, is the waiver status of an individual. And I just want to reiterate, if an individual is enrolled in the HCBS waiver, then they should access or explore and access the HCBS waiver for respite. And once again, as I said earlier, only in instances where they have done that and staffing is not available, then the family or the individual would have the ability to apply for FSS family reimbursement for respite. So once again, I want to thank everyone for taking the time to partake in the training today. We have all of questions, comments that you have included in the chat feature, so we will respond out on those as we go through them. But if you didn't get an opportunity to ask something, or if something comes up afterward, which I know that's how it works for me, please reach out to the Family Support Services shared email address that I believe everyone's seeing on the final screen there still, and we will get back to you that way. So, thank you, everyone, and enjoy the rest of your afternoon.